Chinese medicine, you see that traditional Chinese medicine always keep it all together, trying to have a holistic view. And to cut a long story short, what I'm going to tell about the vagus nerve, for me it has some resemblance about traditional Chinese medicine. The first thing is, they said is the old Greek mens sana in corpore sano, but it starts with orandum est ut sit. Let us hope that it be like that. But this is something which is all there. We did not understand it very well, and today we begin to understand that we have this kind of thinking with our bones, the brain connection and the nervous vagus. This is my first conclusion. First of all the limitations we have as an endocrinologist, imaging people, scientists, surgeons, so on, it means that we have a tendency to see only a part. Evidence-based medicine with good things, but is very limited, cannot handle a lot of things, and it's absent for the majority of our decisions in the guidelines. Evidence-based medicine with a lot of bad things, there's no basic statistics, and they ignore non-evidence-based knowledge, heuristics, experience, individualization, holistic thinking. And then what I would say, and this is the second part of the talk, there is so much we know, but we don't want to know. This is the predisposition before puberty, come back to this in a second, countercurrents, endometrium, microbiota, the nervous system, premenstrual tension, microbiota, mesothelial cells, reflex ovulation, and compensatory hypertrophy. Too much to tell it all, but just look at the principle. This is the old idea. You get menstruation, and in predisposed women, you get implantation, and then you get endometriosis, more and more severe. Something I really would like to change. It's there before puberty. Very nice, beautiful. The most beautiful presentation paper I know about this is coming from Moscow, about with all the arguments that is there before puberty. And if it's there before puberty, it's genetic. At that moment, all the rest is already a consequence. And infertility is a consequence of the predisposition, not of the endometriosis, but therefore certainly associated. Firstly, but if it's mainly a predisposition, if it was there from the beginning, I think we have to look at this in women immediately after puberty or even before puberty. And then it's logical to emphasize prevention, how to modulate epigenetic transmission, how to modulate epigenetic expression, and then maybe I am getting passionate about the nervous vagus and microbiota. Countercurrent systems. I think most of the surgeons know it, but nobody talks about it. This is the first part effect in the uterus. And if you give a treatment in the vagina, all day at 30 years old, you get concentrations in the myometrium which are 10 to 100 times higher. And I'm just remark from the upper vagina to the pouch of Douglas, you have 3, 4, or 5 millimeters. All this is very close. You have a countercurrent system between the ovarian vein and the ovarian artery running together for long distances. And you get concentrations which are at least 10 times higher. So I ask the question, what is a normal concentration of the uterus? And then you know the premenstrual syndrome. Progesterone is relaxant and hypnotic. It's even in rodents, it's a somnifere. If women commit a murder or have a car accident, much more before menstruation, we have some progesterone allergia. And then the strange thing is when you do hysterectomy, it disappears, premenstrual syndrome, but you have a normal cycling ovary. So I'm just thinking, what is this? Is this uterine secretions? Or is this and nervus vagus. One thing is clear clinically, it's only vaginal treatment which is functional. And then I say, look at the endometriosis, where it's localized. In the pouch of Douglas or close to the bowel. So I have my guess today is that the microbiome of the rectum, of the large bowel or the upper vagina, this is causing the genetic epigenetic changes which induce the endometriosis. And then you have the whole story of the peritoneum. Those flat, large cells, which by the way, inhibit completely the transmission of gas, like CO2, like NO. But I'm just, when you look at these cells, touch them, whatever, a little bit of CO2, within seconds, you get a cellular retraction. And then I ask, is this nervous or is this a cellular retraction? And then within minutes you have acute inflammation and so on. And then this is very recent. If you look during menstruation at C-reactive protein, it doubles. Which means, to cut a long story short, if you go from these flat cells, now these cells which are bulging, exposing the basal membrane in between, but of course you have more implantation of tumor cells, probably also more endometriosis. Also this explains why endometriosis is on the right side of the diaphragm and not on the left side. This is one of my hobbies. It's there, the ascending infections and the microbiome. It's on the tail of the sperm cells. They have a lot of bacteria attached, which means stop the sperm cells. Stop the sperm cells to reach the peritoneal cavity, and we know already you have 50% less ovarian cancer. Endometriosis, it's not proven if this is prevention of infertility. And then we have the nervus vagus. The nervus vagus, I can be very short. So I go at a very nice presentation on this, what it does. I like this with the bowels. The nervus vagus is brain, microbiota, and immunology. It's a cluster together. You have the pain in the nociceptor is the activation of nociceptors. How does it work? There is no answer today. My hypothesis today, it's still the nervus vagus. And then you have reproduction, ovulation, uterine contraction, premenstrual syndrome, uterine contraction. It's there, it's very important, poorly studied, it's a reason for pain. And ovulation, reflex ovulation, many mammals are reflex ovulated, the women also, but not always. This I can skip the nervus vagus and the inflammatory of anti-inflammatory pathway. Also the mechanism it is, I think I can skip this, but just to shake the tree a little bit. The nervus vagus and breast cancer. Breast cancer, you see, it stimulated more growth, more metastasis with the sympathetic nerve, and the vagal nerve does exactly the opposite. Very nicely demonstrated, and this is driving growth of the breast cancer, and you have the return effect. After all, the sympathetic effect is direct, the vagus effect is indirect because of intestinal barrier integrity, steroid metabolism. Not going to get into the detail, but it's very clear, it's multifactorial, and maybe stress prevention. So today it's just beginning of what we do. Heart rate variability, this is for the discussion, but this is the way of monitoring the ratio of the sympathicus and the parasympathicus. Ovulation, innovation is very well there. We know that in women with PCO, they have lower nervus vagus activity. When you do a vagotomy, you have changes for puberty, you have changes of ovulation. And then this is something I am looking for it since a long time for the vagotomy. If it's ipsilateral, you have 1 hour to cut. If on the other side you have 4 hours to cut, it means it goes the signal to the brain and comes back. And then you have the Luft syndrome. For those who are younger, Luft syndrome, everything looks like an ovulation, but it's not there. In the oocyte remains within the ovary. This was my PhD in 1980. And in Luft syndrome, you do not have the shedding of all these follicular content in the peritoneal cavity. And just normally, you have concentrations of estrogens and progesterone which are 100 to 1000 times higher than in plasma. Very well studied in the early 80s and then forgotten. This is clearly endometriosis and progesterone resistance. If you have in these high concentrations of progesterone still a growing endometriosis, there has to be a strong progesterone resistance. This is becoming actual today, is that it's associated with having very low doses of contraception. And my hypothesis today, this is nervus vagus. Nervus vagus, again, it's there. The microbiome and the nervus vagus is something which I think we begin to know pretty well. The peritoneum and the genital tract. These are things which we begin to understand. I think the group of Sunway, the reduced vagal tone implement adenomyosis, he explained this already this morning. But you have pain reduction of almost everything. Osteoarthritis, fibromyalgia, musculoskeletal pain, chronic pain, and what interests me more is the ischemic reperfusion, which means all the adhesion formation after laparoscopic surgery. This is a slide I got from Sunway, where you also have an effect on bleeding. And then nervus vagus and pain, we're coming to the end. It's probably contributed to counteracting adaptive plasticity. We know this very well from menopause. When a woman has hot flushes and they give estrogens, the next day she has normal estrogens. It takes 3 months before the flushes go away completely, which means there is some cerebral reorganization, plasticity, something that takes time. And my speculation is that we have mainly centralization of pain because in endometriosis, because the huge area of the peritoneal cavity, 12 square meters, and the nociceptors, which are specific, 90% dormant. How to stimulate the nervus vagus, music therapy, non-invasive transauricular stimulation, respiratory, hum and chant, and then meditation, Tai Chi, all these things. But you see, this is something that Eastern medicine has known since a long time, and don't expect an effect in 2 weeks. We know from hormone replacement therapy and hot flushes, it takes 3 months before it's done. The second thing what I think is important is the microbiota. And I think the microbiota is the reason why the deep endometriosis are close to the bowel or to the vaginal fornix. We know very well that endometriosis is associated with microbiota, which I published out the genetic epigenetic. Whether this is Fusobacterium or HPV, that's not important, but infection is important. Remember this, the nervus vagus, remember what the brain forgot. This is where childhood experience are still effective when you're adults. When I told this to my wife, it's very clear. When you have something which is associated with emotion, you remember much better. Memory is tied to emotion, the gut feeling, and the nervus vagus. And then you can say it's a direct and plastic, and okay, the details are not important, only the principle. So I have two conclusions. There's a lot of evidence that the sympathicus nervus vagus balance affects pain, inflammation, transauricular nervus vagus stimulation reduces pain, inflammation, probably also affect bowel microbiota immunology. And it's tempting to speculate that this is the reason why abdominal pain tend to centralize, and it's tempting to speculate about microbiota and the pathophysiology of deep endometriosis. Therefore, consider, these are my conclusions, consider predisposition. And if you believe in predisposition, emphasize prevention, and maybe we should have no menstruation at all. That's another discussion, whether we should abolish menstruation in all. Consider upper vagina for treating the uterus, and consider the nervus vagus. Keep an open mind. Women are complex, and if you have a complaint, always look at the individual woman. Stop thinking evidence. And I heard today placebo therapy. But if the placebo therapy means that the nervus vagus becomes activated, then it's a good therapy. I have seen with trials, double-blind placebo-controlled in placebo, women who needed for pain injection with morphine were almost completely normal. So I think the nervus vagus, we begin to understand a few things, but it's going to be very important. Just to finish, this is something which we are doing at this moment. Dr. Senwei Guo, who is there, if you would like to contribute to this. Thank you for listening.
Thank you so much.